Welcome to the AIM Spotlight Series. I'm Dr. Karina Testa, owner of AIM Sports Medicine and Physical Therapy in Hermosa Beach, California, and I'm the host of the AIM Spotlight Series. With us today is someone I've recently met who has an extensive knowledge base on functional testing. So think blood test, stool samples, saliva tests, and she knows how to use those results to design a plan for better health. Chaana has a background in nursing, and she earned a master's degree in human nutrition and functional medicine. And she's part of the clinical team at Designs for Health, where she interprets complex functional lab results and designs actionable strategies. And she has recently started her own business called My Wellness Consultant. So welcome, Chaana.
Thank you. Thank you for having me.
Of course. So I always like to start with, tell me how you even got into nutrition, like what sparked that interest, especially because I know your background was more in nursing, and I
Mhm.
think you even said like ICU nursing.
Yes, exactly. So I have about 25 years of both working in the pharmaceutical industry and then also, like you said, hospital-based nursing, so ICU in the emergency department. So our conventional medical system, in my mind, is extraordinary. I've seen it do amazing things, but I do think there's a place for something like functional medicine that complements it really well. And I saw a lot in the emergency department, a lot of people younger and younger and younger, for example, getting type 2 diabetes. And this is an area really where functional medicine has a place, since functional medicine really wants to understand the why and the root cause behind some of these chronic diseases. So another like really great example that I got interested in functional medicine is I have a really strong history of cardiovascular disease, and a lot of time that is treated with a statin. So if you have high cholesterol,
Right.
you're typically given a statin. And we know that, we don't have high cholesterol because we have a statin deficiency. That's not,
Correct. Good point.
that's not what's going on. But functional medicine will look more at systemic inflammation and, why are the LDL becoming oxidized? Why are they becoming sticky, dense, and proatherogenic? And so functional medicine will uncover the why and the root cause behind that and treat that so that you don't have these long-term effects. So the two systems work really well together. I prefer functional medicine. It's like playing a detective.
Yeah,
But of course, conventional medicine definitely has its place.
got it. And I was going to ask you to kind of explain a little bit for people that may not know what even functional medicine truly means. Is it a series of the tests, or is it the type of practitioner, or is it more the philosophy?
I feel like it's definitely more of a philosophy because we're kind of taking in the person's entire environment. So we're looking at things, even as such, even things like, does the client or patient have purpose in their life? Because we know that having a sense of purpose also improves outcomes. So
Mhm.
we get even down into the nitty gritty of that. We look at relationships, we look at a sense of purpose. Do you have toxin exposure?
Okay, that makes more sense.
Mhm.
And so what prompted you, or how did you get into the functional tests? And maybe we could talk about that first, and then you can kind of give us a brief overview of what all some of those functional tests are.
Yes. Well, I will have to say that I love poop. It sort of sounds weird, but I think that there's more and more information coming out about the microbiome or the microbiota, and I'm hugely fascinated by it. We have about 30 trillion human cells. The microbiota make up 38 trillion. So we're about a 1-to-1 with the microbiota. But when we think about the processes of the microbiota, and 95% of the microbiota live in our gut. I mean, it's
Hmm.
all over our body, but 95% live in our gut. But when we think about the fact that they have, 10 to 1,000 times more biochemical processes than the human cell, that in and of itself, it's incredibly profound and has a very impact on our overall health. So
Okay.
I became very interested in functional testing, especially stool testing,
Hmm.
which is really easy to do. And it gives such insight into not only our local gastrointestinal health, but also our systemic health. And it's a really fun way to I don't want to use the word manipulate, but a very fun way, an easy way to sort of begin to change systemic health through the microbiome, through the
Okay,
microbiota.
so let's dive deeper into the poop part of it. So what exactly does it tell you? And I would imagine there are lots of different tests that you can actually run on it. But what are maybe the number ones that you or the top five that you run, and what does it tell you?
So a lot of them more or less tell us the same thing. Maybe a different company will offer slightly a different variation, or maybe they'll do provide a different. I typically choose which test to do based on my assessment of the client. You know, if they're having sort of acute, if they've gone out of the country, for example, and they're home now and they're having acute symptoms, that
Okay.
would direct me towards a different test than maybe if it's more of a chronic issue, then I would choose probably, do you have hidden infections? So we get into all of those things, and that doesn't necessarily mean that you need a functional test to do that. So I
Okay.
feel like it's more of a philosophy, another company. But the core of the test is pretty much the same, and that is it does give us some insight of the actual bacteria, actual fungi, a different marker or additional markers. But
Hmm.
in general, the core of the tests are pretty similar. Candida, for example. And then it does give us some markers about how well are you digesting your foods. It gives us a really important marker that assesses the lining of the gut. So we're assessing for something that's called leaky gut, or the gut being permeable, which is strongly linked to systemic. Having a leaky gut is linked to systemic disease. So that's
Hmm.
a wonderful marker to include. So some tests include that marker, some tests don't. If there's inflammation in the gut, and then how is your local gut immune system? So we're looking at that as well, which gives us some insight a little bit into also overall health. So there's a lot there that we can do a lot with. And I like from there to that sort of directs my interventions. So from there, I can suggest a certain food plan, prebiotics, certain probiotics, and then postbiotics. And that way we can sort of start to either fix or shape the microbiota or enhance it to better influence our overall health.
So does that stool test tell you what microbiomes or what stuff is deficient in a
Yes.
person, and therefore they need the pre or pro or postbiotics?
Yes, exactly. So sometimes it'll tell us they're actually, so what I really I get so jazzed.
Getting very excited about poop.
It tells us it's such an underrated area in our culture, and I feel
Yeah.
like it tells us so much about our health, and it's so easy. You know, it's so easy. It's something that we should be doing daily, and immediately you can tell, okay, something's not right. You know, it's such a great insight on how our body is disposing waste. You know,
Yes.
we want to
Yes.
be taking out the trash every day, you know,
Right.
and that gives us a lot of insight. But now I forget what your question was about the
If it tells you that you have
oh
certain
yeah,
microbiomes in there, but you're deficient on other
yeah.
microbiomes.
So what I think is so interesting is there can be too much of a good thing. So sometimes we'll have commensal or quote unquote friendly, and I don't like to use that word, but it's sort of an easier word to wrap your mind around. So sometimes you can have too many friendly bacteria,
Hmm.
and that actually is also a form of imbalance. So sometimes we think of an imbalance as caused by bad guys, but you can actually
Right.
have an imbalance of having too many good guys, and that will throw off the total balance, if
Okay.
that makes sense. And that I see quite a bit actually. And that can happen if a client or a patient is taking an inappropriate probiotic. So, an inappropriate probiotic, if we go into a CVS or our local pharmacy and we just pick up something off the counter, that can actually create an imbalance. So,
Okay.
and then more specifically, is it the right strain? So, I'm really picky about the probiotics that I recommend. They have to have, I call it three names: a last name, middle name, and a first name. So I get really picky about which ones that I suggest. and especially based on the information the test is providing me.
And so what would be a symptom, or what would the person feel if they are out of balance, whether it's out of balance because they've got too many bad ones or out of balance because they have too many good ones?
So that's such a great question because symptomology wise, you can feel bloated, sluggish. So you can have sort of local gastrointestinal symptoms, but then you can have more global symptoms or systemic symptoms like joint pain, for
Okay.
example, or headaches, or you can even have skin rashes
Hmm.
or eczema. You can even have, for example, hypercholesterolemia. So I take a probiotic that specifically addresses hypercholesterolemia.
Okay.
I take another probiotic that specifically supports, or I would say, mitigates bone loss, for
Okay.
example, like for
That's an
osteoporosis.
important one.
Yeah. So it can be down to sort of that level of
So
intervention.
very, very specific.
Mhm.
And
Yeah.
I didn't even realize that the imbalance in a microbiome could actually affect more systemic things. Well, I guess I shouldn't say I didn't realize, but the first thing I always think of is just more gastrointestinal
Yeah.
issues, whether the person has, I guess, constipation versus diarrhea or stomach issues or IBS or something like that.
Yes, absolutely. So you're right. It can show us clues into sort of, I'll just say like local gastrointestinal things, but it also gives us a lot of clues about what's going on systemically. And that's why I think that I get really jazzed about it because we can't underestimate the power of the microbiota.
Yes.
I have a mentor that considers it another organ. It's that
Yeah.
profound in its influence for our systemic health.
Well, and I feel like it's really on the forefront right now because
Yeah,
there are a lot of people talking about it, and then even connecting microbiome and gut health through the vagus nerve back up to the brain, right?
absolutely, 100%. And that's so fascinating because it's sort of this bi-directional communication. So
Mm.
even when we know that intervening with like cognitive behavioral therapy for individuals that have irritable bowel syndrome, that in itself influences symptoms. So you're addressing cognitive behavior, but it
Mhm.
is addressing down locally in the gut. So it's a
And that's,
bi-directional.
yeah,
Mhm.
via the connection with the vagus nerve.
Yes. Mhm.
Got it. Got it. Okay, so we've talked a lot about poop, and I'm sure we will talk more. What are some of the other big functional tests? Are there blood tests, saliva tests? What are
Yeah,
the tests that
another big test that I really like to use is called metabolomics. And that really is looking more at the mitochondria and how well is the patient producing ATP. So we know that ATP is a currency chemical of the body, and it's needed for almost every biochemical reaction.
like
So
the energy block, right?
absolutely.
Energy.
Yeah, absolutely. And so we look at sort of how well is the client able to use glucose, proteins, fats to make ATP. That
Okay.
same test gives us insight into mood and neurotransmitters. There's some information that tells us whether maybe we call it sort of brain on fire or sort of an inflamed brain.
That like someone that would be very stressed would have an inflamed brain, or is it something different?
Yeah, we can identify sort of like what is needed in those enzymes or what's lacking as a cofactor for those enzymes to help support mood and stress.
Okay.
And then the brain inflamed, I find, is very much related to the gut markers also found on that metabolomics test. Another, going back to the gut brain axis.
And is that I can't even say the word, but is that a blood test?
That's a urine test.
Oh, urine test. Okay.
Hmm.
Okay.
Yeah. So other markers on that test are how well is the liver working, also glutathione status, one of the most important antioxidants of the body.
Do we want more of that or less of that?
We typically want more.
Okay. Okay.
Typically want more of that. Yeah. And we want to sort of protect those pathways. And then also it ends with some gut microbiome markers as well. It doesn't give us, it gives us an indication more globally of the gut microbiota, not actually individual bacteria. That is more on the stool test.
Got it. Okay. Any blood tests that you run as well?
I do also look at blood tests, and I typically use different parameters for identify like different reference ranges
Hmm.
for that. So I'm very fascinated by a lot of the different blood tests, for example, that are well researched, but may not be something that's used in everyday, something that you would go to your family practice doctor
So
for.
not the standard, what is it, CBC that they
Yeah,
run,
yeah.
or I'm trying to think what the other ones would be, maybe cholesterol test, the fasting cholesterol, or and then maybe a glucose test.
Yeah. I mean, for example, there's some hesitation in a lot of practitioners in conventional medicine to run like an HSCRP, high
What is
sensitive.
that?
That's a high sensitivity CRP. Like it gives us an indication of systemic inflammation.
Okay.
So I really like this test. I that gives us such a okay, so gives us sort of another window to sort of go through and to go down to sort of figure out what is causing this inflammation. And then we're thinking, is it coming from the gut? You know, do you have a hobby where you're being exposed to toxins? You know, some of
Okay.
these, you know, is it coming from a poor diet, for example? So it just gives us a little bit more insight into systemic inflammation.
Okay. And you mentioned that when you were more in nursing that you saw so much type 2 diabetes in younger and younger patients. So what tests are you doing in your practice now to help identify that, or perhaps it's to identify the pre-diabetes portion of it?
Right, right. So fasting blood glucose, you know, hemoglobin A1C, C-peptide, you know, we want to see what's going on the insulin side of things, what's going on the blood sugar side of things, to kind of address that. I think a lot of that, unfortunately, is coming from not only eating, but lack
Hmm.
of exercise. So I think it's really a combination of those things. And what's really nice for in functional medicine is we also give different types of recommendations for exercise based on what we're finding on these functional tests. So sometimes, you know, yoga or Tai Chi may be more beneficial in a certain patient based on what we're seeing than it is, you know, high intensity work at that time on the test
Hmm.
at that time. You know,
Yeah.
if you're sort of this wired but tired or high cortisol, you know, having them go into the gym and further drive cortisol doesn't make sense in that case. So again, it's really a balance. And I enjoy looking at the functional tests and through assessment and evaluation, really making a protocol that's unique to them,
Mhm.
unique to what we're seeing on the tests and then what they're telling me. And that's the main thing about functional medicine is it's typically should not be a one size fits all. I've never recommended the same protocol to two people. Every person I've ever seen has always received a different protocol
Got it.
based on them.
Going back to what you were talking about cortisol, can you explain a little bit about how cortisol works in people, and because you mentioned exercise can bring the cortisol up, but sometimes we want the cortisol down. How,
Yes.
how does that work in our system?
So cortisol is the famous flight and fight hormone. And when
Hormone?
you have elevated levels of cortisol, that also is a trigger for the body to release more glucose. So that in and of itself, if you have elevated cortisol, leads to higher glucose
Okay.
and also leads to higher cholesterol. So
Okay.
that's also like a really interesting area. You know, I think
Yeah.
I finally kind of made this connection growing up and having a dad that has very severe heart disease and them saying, you know, he's a type A personality. A lot of people with type A personality, you know, have high cholesterol. Well, there's actually a pathway for that in the
Yeah.
body, you know, and so it does make sense. So, for example, for him, you know, doing exercises that are more tai chi based or more yoga based is really important to sort of balance that out. I think too the cortisol changes also based on where we are in our hormonal status. So
Okay.
typically postmenopausal women will have higher levels of cortisol, and that sometimes can produce visceral adiposity.
Okay.
That sort of that
Belly fat.
exactly. And that really is going to drive insulin resistance further. And so there's ways to sort of mitigate that.
Mhm.
and certain exercise that is recommended for a woman that's postmenopausal that we're seeing that in. So it's
All
very
right.
unique to each person.
Yeah, I know that's what the question's going to be is, okay, what exercise do we need to do to reduce the belly fat when we have, maybe we don't even know we have high cortisol, but maybe if we assume we have high cortisol levels, what is that plan right there? Because I bet every
So
woman
I
would
feel
want to
like for
know.
yeah, for postmenopausal women, it's so important to lift heavy,
Okay.
I call it jump training or plyometrics,
Hmm.
and then to do things, I would say sit or sprint interval training. And it's only 1 to 2 times a week for sprint interval training, heavy lifting 2 to 3 times a week, plyometrics. I think it's up to 60 reps per week. So you can split that up how you want to. But those three things are important. But what's really important with the exercise is recovery. So if
Ah,
you're not
yeah,
recovering, which I
yeah,
feel like a lot of us, I'm in that patient population and I'm going.
right.
I think because of my personality, more is better. And it actually is working against me. So I really need to rest and allow cortisol to come back down, recover, and then hit it hard again. So having these sort of polarized moments
Hmm.
in our exercise plan is very important in a postmenopausal woman.
How do we know if our cortisol is, you mentioned resting so that our cortisol comes down, but how do we know when it's down?
So what's really interesting is HRV. So
Okay.
HRV is strongly related to parasympathetic.
Okay.
So that gives you an indication of your parasympathetic nervous system. And so we're trying to balance sort of parasympathetic with sympathetic.
And HRV stands for heart rate variability.
Yes, exactly.
Okay.
Yeah. So I wear a wearable, and so that really helps me. You can also use heart math. It's like a tool that is really great that you can wear in your ear, and that kind of gives you an indication of your heart rate variability. And just by doing breathing exercises, the heart rate math will show you that you're lifting your heart rate variability, which is good, and you're getting into coherence, into a more parasympathetic state.
Mm.
I also feel like if you're if you're sort of wake up and you're, not feeling it, that you're not
Yeah.
well recovered, you've done too much and you need to sort of take it easy that day and do more breath work, yoga work, more restorative type work.
And is the HRV and the heart rate variability, I mean, I have a wearable as well with my
Yeah.
ring. And is that HRV supposed to occur while we're sleeping?
Yes. So the HRV will, it's, I like to do my morning HRV,
Okay.
and then my resting heart rate. So I use resting heart rate because if you're not able to get into a low heart rate, that also shows that you're not well recovered.
Okay.
But if you have a high resting heart rate, that means you're not recovered. So you want a low resting heart rate. So I use a heart rate and I use HRV to sort of identify if I'm kind of well recovered. And it doesn't mean to lay in bed all day. That's not what that means.
Darn it.
Yeah, yeah. But it's almost like we have to get out of that state. We have to, it's like we have to get out of that state in the sense of doing mobility work, yoga or tai chi, not like power yoga.
Right, right. Nothing that's going to bring your heart rate up, but more things that are good for your mobility, stretching or whatever, but that keep your body, I guess, a little more relaxed.
Exactly. Mhm.
So someone, if they don't have that wearable, can they just take heart rate in the morning when they're resting or when they first wake up? Is that a good time to check what their resting heart rate is?
I think so. Right, first thing in the morning is a really good time to check. I feel like and maybe it's because I have the wearable, but there are times that I can check in and sort of just feel run down, you
Yeah,
know, just run down. And a lot of that comes from, did I work too hard in the gym and not hydrate well? Did I work too hard in the gym and oh my gosh, I forgot to eat lunch? It's
yeah,
like that kind
yeah.
of thing that the next day I reflect back, so I think, oh no, I feel, really run down. It's not a, for me, it can't be an excuse not to do work though. You know, you
Right.
you know, you still have to do something to set yourself up better in order to exercise the following day so that you can hit the highs and then get back down into a parasympathetic.
So in other words, it wouldn't necessarily be a day to run 6 miles, but it might be a day to walk for a mile.
Sure. Yeah, exactly.
Okay,
Mhm.
that makes more sense.
Yeah.
So switching gears a little bit, tell me a little bit, what is the typical client that might seek out a functional test? Like, how are they, what is it that they're feeling that they suddenly say, I want to do a poop test or a blood
Yes.
test or a urine test, or what does that typical client look like for you?
So I hear this a lot. I hear that they say to me, I just feel off. I just feel off. But my primary care doctor tells me everything's normal. Nobody can find anything. I think I'm going crazy. It's like, is it just in my head? And the answer is no. It's not in your head, So they they're not getting answers from their family practice physician,
Okay.
told them that everything looks pretty normal. And so then we start to kind of dig a lot deeper into what's
Yeah.
going on. And then based
And
on sort of their symptoms or
mhm,
their chief complaint or what they're endorsing, I'll kind of decide, which way to go.
which tests to do and what's going to give you the most information
Yeah.
to, like you said, to be a detective and figure out what's
Yeah.
causing them to just feel off.
In the first appointment, I like to patients get a lot of time with me
Okay.
because it takes time to hear what a patient has to share with me.
Hmm.
So they get a lot of time, and I want to hear everything from were they born C-section or were they born vaginally? Were they breastfed or were they given formula? So did they have a lot of ear infections growing up? So I like to go into quite a bit of detail. I want to see like kind of what set the stage or the foundation for their current condition, what triggered the condition. So maybe the stage was set and then they traveled abroad and they got sick abroad and they've just never felt the same since that. They think back and go, you know what? The last time I felt good was before that trip I took 5 years ago, something like so. That would be like a triggering event.
Okay.
And then I want to understand, well, what's going on that their immune system couldn't clear maybe that virus or couldn't bounce back from that triggering event. So it takes a little bit of time to sort of get the information. And then once I get sort of the lay of the land, I have a better idea of which direction to go.
And so tell me a little bit about when you mentioned, how did you come out as a baby and breast milk versus formula? How do those play into where we are today as adults?
That is the stage of what sets for your microbiota. So if
Oh.
you're born vaginally,
Hmm.
you have a higher diversity of gut microbiota versus if you're born C-section. Sometimes the first gut bugs they see in a C-section born baby is from the skin.
Okay.
So in the gut.
Yeah.
So and then we move on to breastfed versus formula. You're getting a lot more diverse microbiota if you're breastfed versus formula fed. So
Okay.
already, the stage is sort of being set for the future of and now we're going now let's say for example, it's a child as a child the client or the patient had a lot of ear infections. So that tells me there was a lot of antibiotic use.
Okay.
So that further diminishes the microbiota. So that kind of and now that we reflect back what we talked about earlier, if the microbiota, if we think of it as an organ
Hmm.
and the profound impact it has on systemic health, and we're sort of set the stage for not a very robust or diverse microbiota, you can kind of see how that might have a role.
Got it.
Mhm.
But then in terms of changing our microbiome, changes can happen fairly quickly, correct? Once you've got better foods coming in, some of the pre and probiotics and postbiotics,
Yes.
correct? That makes it quick change.
Sometimes, it's sort of like our microbiota is as diverse as a fingerprint for each person.
Hmm.
So sometimes, yes, you may have lost a species, you know.
Okay.
Other times they may be diminished. And then just to your point, by feeding the correct, like it's a kind of thinking of it as a garden, like an
Hmm.
internal garden. If we feed the garden the right fertilizers, it will flourish and it will grow, and then it will bear fruit, kind of, which are
Yeah.
like they're postbiotics. So they make short chain fatty acids, which then affect our systemic health. So, absolutely, you can feed them the right stuff, which is a prebiotic, and you can choose different prebiotics based on which species you want to grow.
Okay.
So, for example, the big one that's all over social media is Akkermansia. So there are things actually that you can eat to improve your Akkermansia levels rather than taking a probiotic. There's some debate now about whether or not you can reseed. So
Mhm.
taking a probiotic in the stool, you'll see the species.
Right.
But then if you stop taking the probiotic and you consistently retest the stool as you move out, you you see that less and less. So
So it didn't really seed in your
right, yeah. Now they do say that there's science coming out now that the impact maybe is still there, but the actual species is not there.
So
So
would you say then it is ultimately best to get some of this stuff from our actual food?
100%, 100%.
Which is challenging since the way that we eat now versus, a couple hundred years ago is so different. We have so many processed foods, we have so many packaged foods. Even our fruits and vegetables are not as nutrient dense as they used to be unless we are able to get, 100% organic and
Right.
have the variety, correct?
So in that case, and I agree, food first is the
Mm-hmm.
best approach. But there are supplements and specific prebiotic powders that
Mm-hmm.
target certain species. So, for example, Faecalibacterium pranitsii is a big butyrate producers, and which is really important, especially in joint pain. So we can feed specific prebiotic fibers
Mm-hmm.
that will fuel that Faecalibacterium pranitsii to grow and then of course produce more short chain fatty acids. So there's different. I like to sort of manipulate, I hate that word, but I like to use prebiotics to sort of change the microbiome to influence our health in that way.
Well, I'm glad you mentioned joint pain because, in physical therapy and here at AIM, we see a lot of patients that have joint pain, whether it's their primary issue or just something they're all dealing with, maybe with aging or maybe with chronic pain from an injury. So how can we use some of the probiotics that you're talking about or the gut microbiome in general to help with joint pain and maybe even joint inflammation?
So I'm preparing a case study with Connie Karstens, who is a practitioner at the Lamb Shop. So together we're preparing a case study for publication.
Hmm.
And this is just a great example of sort of how we use the gut testing and then came up with a great protocol and then influenced her systemic health,
Hmm.
but really her joint pain.
Okay.
She had, I think she came in with like a score of 75. So we assessed her a medical symptom score. So we assessed her from head to toe in a
Hmm.
questionnaire, and to brain fog, down to joint pain, gastrointestinal symptoms, sleep, all of that. And she scored a 75. And in 3 months, she dropped down to 13.
Wow.
Yeah. And joint pain, I think, was 10 down to 3. So 10, I think, is almost the maximum, I think, in that section, down to 3. And
Wow.
like as an example for her, and she actually didn't even come in as a chief complaint of joint pain. She was more complaining. I mean, she had joint pain, she saw chiropractors, she was seeing practitioners, but she also just didn't feel well, had brain fog,
Hmm.
digestive upset. So we did a GI test, and she had leaky gut, so elevated levels of zonulin.
Okay.
And she also had some sensitivity to gluten,
Hmm.
and she had low commensals. We kind of
What
talked,
does that mean?
so she didn't have a lot of friendly ones.
Okay. Okay.
So
Got it.
she didn't have a lot of friendlies. That's what I say. So we changed her. Connie immediately gave her something to soothe inflammation, so a supplement to kind of calm down inflammation, something topical. But then I think it was a fish oil, and then we did the gut testing, and then we saw what I shared with you, and then based on those findings, we suggested an appropriate prebiotic, probiotic, and then a postbiotic. And we know that not necessarily. I wouldn't say she had osteoarthritis because we didn't, that wasn't a part of our intake.
Yeah.
But we know in research that patients that have leaky gut have worsening outcomes in osteoarthritis and pain. And conversely, when we heal the gut, they have better mobility and less pain. So,
And how old was this patient?
well, that's in the research for older
Okay.
patients, but
Okay.
this patient, I can't remember how old she was, but she was younger.
Okay.
She was
Okay. So she wasn't someone that would have necessarily even had osteoarthritis at this point in her life.
no,
Okay.
I wouldn't think so. No.
And are you planning to continue to follow her to see if
Yes,
in 10 or 15 years to make sure
that would
she's,
be fun to do.
yeah,
That would be
yeah.
really fun to do. Yeah, yeah. But we know that in osteoarthritis that we can both in osteoarthritis and in musculoskeletal, any
Okay.
sort of muscle, that if you have any sort of injury that causes inflammation, that injury doesn't stay just local. Let me back up. Those inflammatory markers or those cytokines don't just stay local. They float throughout the entire body and also can cause leaky gut. So it's a bi-directional relationship.
So that sometimes the leaky gut is because of the cytokines that came from the joint inflammation versus the microbiome system.
Sure,
Okay.
exactly.
I didn't
And
know
we
that.
know that intervening at the gut level
Hmm.
and also providing postbiotics has improved outcomes in OA. And also there's other postbiotics that have shown to like improve muscle recovery, for example. So this idea of postbiotics is very, very fascinating to me because that's sort of what I think of them as sort of text messages.
Okay.
The gut bugs are sort of sending out text messages throughout the entire body. And they're showing to have a huge impact on systemic health. And so how do we intervene on that is sort of my hobby.
And so let's back up a little bit in terms of the difference between a prebiotic, a probiotic, and a postbiotic.
Yes.
And when do you take those?
Yes. So a prebiotic, so for my way of practicing, and especially from my mentor, is really focusing on prebiotics because I like to grow. If you have it, let's grow it. That's sort of
Okay.
how I think of it. So a prebiotic are specific different types of fiber. So for example, polyphenols, or like, for example, pomegranate,
Okay.
will feed a gut bug that will then make a postbiotic that's urolithin A that's shown to improve muscle and muscle recovery in
Okay.
mature patients. So PHGG is another prebiotic fiber that is shown to grow specific bacteria that is a bacteria that's well known for producing butyrate, for example. So it's the fuel or the food for the gut bugs is the prebiotics.
Okay.
Probiotic is the bugs themselves. So
Okay, that makes sense.
yeah. So and I'm very picky about this. Ooh, because they have to have three names, right? We
Right.
kind of
That's what
discussed
you
that.
said.
They have to have a first name, a middle name, and a last name. And a lot of products only have the last name and a middle name, for example. So it'll say Lactobacillus acidophilus, but it's missing the strain, or it'll say Lactobacillus rhamnosus. So I like to get down to the strain level when I recommend a probiotic. So I want an actual strain. So I want not just the genus and the species, but I want a strain. So an example for that would be Lactobacillus rhamnosus GG or Lactobacillus rhamnosus HN001, because even though they're both Lactobacillus rhamnosus, the GG is better for gut health for someone that I want to address that, where the HN001 is better for a patient that has allergies. So they
Wow. They're
really
totally different.
yes, yes, it gives me goosebumps.
Yeah, so people are basically going in and buying a probiotic and have no idea what it's for or even if it's going to help them.
Yes,
But
this
they're
is what,
buying it because everyone says take probiotics.
yes, yes. So
Well, that's a waste of money.
it's a waste of money, and I don't know if they may already have that species and that strain.
Right. And what you said is if they already have it, then you're giving too much of a good thing, and then you may have a
Yeah,
symptom based on too many friendlies.
Exactly, exactly.
Because
So
it's not like vitamins where if you certain vitamins that are, you take too much and you just pee it out, and yes, you wasted your money, but at least it's out of you. This
right,
one can actually have a side effect.
right, right. So that's why to that point I'm super picky about my recommendation. So if I have a postmenopausal woman that has a condition, I will scour research to try to find a study where the patient population of that study was also postmenopausal with that condition, and what was the strain that was used and for how long was it used and what was the dose. So I get very, very specific.
Got it.
And I do that because the science is there. We
Hmm.
know better, so let's use it if it's there.
Yeah,
And the postbiotic is sort of those text messages that the gut bugs send out systemically. So butyrate is a great example of one that is a potent anti-inflammatory. Urolithin A is another example. So those are fun to sort of use as well to influence systemic health.
because those are the after product though. So if your gut microbiome didn't make the proper product to send back out to your system, then you can add the postbiotic to supplement that.
Yes.
Okay,
Hmm.
that makes more
Absolutely.
sense.
Yeah.
So tell me, if a patient, what can a patient expect when they first contact you, and what does that, you alluded to it being, a long visit and a lot of interview and investigative work. So tell me, walk us through what it's like to be a patient for the first time with you.
I do require a bit of information from them initially. And if they
Okay,
have any blood tests that they've also taken, or if there's
already done.
recent functional tests that they've done, I also want to know, what supplements that they're taking. I'm also kind of picky about my supplements as well. So, the functional tests direct the supplement recommendations. So, for example, I was helping a practitioner that he was going through his assessment. This was his assessment of the patient. These are the supplements that they were taking, and they were taking a statin, but also red yeast rice, and they were taking biotin, a B supreme, a multivitamin. So they were taking things like double whammies of things,
Yeah,
I would say.
yeah,
Sometimes, the latest greatest supplement comes out on the market. It looks kind of interesting, so they just add that on,
yeah, yeah.
but it may not be so. So when she's using sort of like for her, so for example, if a patient came in and they had the supplement list, and I see red yeast rice and I see a statin, I'm immediately thinking mitochondria dysfunction, in the sense that that's a lot of two things doing the same thing, and that's the same pathway that makes CoQ10 as an
Okay.
example. And CoQ10 is super important in the electron transport chain, which helps us produce ATP.
So
So
this is kind of where your background working with Designs for Health comes in and helps you discern what all the different supplements are and
yeah,
what they're doing, and that maybe people are overlapping two things that they may not need.
right. Hmm. And for example, if the statin is not working,
Hmm.
then my mind is, we've covered that pathway. Let's think of a different pathway. So if the statin is not working in the sense that the cholesterol is not meet the goal,
Hmm.
it may not necessarily mean taking more of that statin. It could be, let's intervene in a different way. Let's intervene
Yeah,
using a probiotic, or let's look at using psyllium fiber. Fiber is so great to lower cholesterol. It has tons of research. It's so cheap, and it works really well.
yeah,
So there's other ways to sort of intervene in that pathway rather than just doubling down, which then could create another problem, which would be a CoQ10 deficiency,
that makes sense.
or which can also bring on joint pain, muscle fatigue, muscle aches and pains, things like that.
And so once you've done your assessment and you've come up with a plan, obviously you're selecting which functional tests are going to really help you dial in what they need to do in maybe the pre and probiotic and postbiotic part of it, or maybe what lifestyle changes they need to make. Then how often do you see the client, and when do you retest the functional tests to see if they've changed?
It depends on the protocol. So if there's some unfriendly bacteria that we want to consider crowding out, then I want to go through that entire protocol. And sometimes that protocol can take up to 8 weeks.
Okay.
So I like to test, quite a few months after the 8 week mark until things can kind of settle down.
Okay.
But I am a huge proponent of making an intervention and then reassessing. I mean, that's
Right. Because how do you know if it's working?
Exactly.
We're not reassessing.
And for me, it has to, the protocol must be effective, it must work. So if it's not working, then we need to make some changes. If it is working, let's stay on it and then retest, So that's sort of how I go about it.
Okay.
I also address things like exercise, sleep, and we talked about, a sense of purpose, community. I work with an exercise person,
Mm-hmm.
exercise or fitness professional that helps me. And I also have on staff a doctor of psychology.
Okay.
Some,
Very important.
yeah, so I don't think that it can just be changing a diet or taking a supplement. I think healing takes place, in a village. It takes
Mm-hmm.
a lot of practitioners to support somebody in their healing journey. And if you're not in good relationship, you can't supplement your way out of that.
Yeah. Just like you can't exercise away a bad diet.
Yeah. Yeah. So if it's affecting your health in some way, then there needs to be, a lot of deep work that needs to be done too. And those, we all know that that can affect health as well.
Absolutely. Well, how does someone find you if this feels right for them, that this resonates with them, that this is something that they want to pursue?
So my website is mywellnessconsultant.com.
Okay.
And that's also my Instagram address as well. So they can contact me either through either of those ways. And then I am more than happy to talk with anybody, for 15 minutes, a half hour, just to see if it's something that I can help them with, see what they've already tried, to see if it's a good fit.
Nice. I like that. Well, thank you so much for spending this time with me, Chaana. I
Yeah,
really appreciate it. I learned so much that I didn't know.
yeah, this
All
was
of this.
so fun. Thank
Good, good. I'm
you.
glad. Well, hopefully we can have you on again in the future and pick another interesting topic to expand on.
Oh, that would be great. It would be my pleasure. Thank you so
Great.
much.
Thank you.
Thank you.